Hi, my name is Rebecca McClary, and this is our story. My pregnancy started as any pregnancy, I thought. I was sick all the time. That's normal, right? At 24 weeks, we went in for just a regular checkup, an ultrasound, and she was a few ounces underweight, so they put her on growth watch. I went back at 27 weeks and 5 days.
I was able to go to the appointment because one of my buddies at work just asked voluntarily if he could take my shift. First time that's ever happened, and it hasn't happened since.
The ultrasound showed that 100% of the blood flow in the umbilical cord was completely in reverse, and there was no way to turn it back. She was getting no nutrients, and they called 911, and we were taken by squad.
At that point, the alarms weren't going off in my head. I was like, we just need a second opinion on this.
Our appointment was at 1 o'clock, and she was born at 2:38 p.m. That's how quickly everything went.
When I got there, she was already in a operating room.
There was no time for a regular C-section, so I was completely put under, and an emergency C-section was performed.
She was so little, she ended up being 1.2 pounds at birth.
It was a good 2 weeks before I got to hold her, and even that was just lifting her up in my hands in the incubator. She was just too fragile.
Every time we could, every time they let us back to see her, we just go and dress up in scrubs and just look at her. And
after our baby's born, they lose some of their birth weight, and Savannah was down to 14 ounces. I'll never forget the doctor looking at me and saying, "We have to be realistic what we're working with here. Savannah's 14 ounces, and I just drank a 12-ounce can of Coke at lunch." That's when it hit me how fragile she was and what the outcome could possibly be. She persevered and she got stronger. After 109 days in the NICU, Savannah came home.
Coming home with 5-pound Savannah, still on oxygen. She had numerous medications, a feeding tube, and she did great for a couple of months. She had some underlying medical issues.
2.5 months after she was home,
she still wasn't gaining weight like she would at that point, and it was because her lungs just couldn't supply her body with enough oxygen. It was taking too much energy for her just to breathe, and she couldn't retain any of the calories.
After she was home, she aspirated a large amount of fluid of her formula into her lungs. We took her to Akron Children's Hospital. Within the first few hours, her oxygen levels dropped. And by the end of the night, she was paralyzed through medication to keep her stable and intubated. And my little girl was again in a lot of danger. She was really, really sick.
Within a couple of days of being there, she got her trach surgery, and she was on a ventilator.
She was diagnosed with severe pulmonary hypertension. The aspiration caused severe damage to her lungs, which were already damaged from the premature birth.
Actually, a couple of those weeks she was medically paralyzed, so we couldn't see her smile or hold her or comfort her for a couple of weeks.
She also got a feeding tube put in her stomach so she wouldn't aspirate again. And at that time, she was given a permanent IV because of all the labs.
She had multiple bronchospasms, which basically her heart rate goes down to 0. And just on the edge of your seat, just hoping to see the numbers come back up.
One night there that I'll never forget is the doctor telling us that they had one last option. It was new, it was experimental, it was a medication. And it was actually used on chemo patients. It's a Class X drug. And it was our last option before he would have to call Cleveland Clinic to talk about a lung and possible heart transplant. And after courageous prayers and lifting everything up to the Lord, she did a complete 180.
And that's when everything turned around for her.
She spent 120 days in the PICU fighting for her life. And again, by the grace of God and medicine and technology that's out there today, she persevered.
She's just gotten stronger and stronger, and now she's 2+ years old, and she's just like any other normal toddler, just throwing stuff and not listening to her parents.
My hope is that with the grants given to March of Dimes, that they can find cures for every reason of premature birth. Every baby can be born with a healthy start.
I just hope the research that March of Dimes is doing could streamline their tough period, and also every child just given a chance to succeed and just be happy toddlers just like we have right now.
And diagnosis is within 2.5 years. You'll never know anything happened. And that's our story.